Some people find chiropractic, while others, well, they get dragged into it by their dad while nursing knee pain, insomnia, and a shredded rotator cuff, thinking they're just checking a box, not starting a whole new chapter. Well, that second guy, he's our guest today. Dr. Rich Benjamin didn't just discover chiropractic, he experienced it from the inside out. What started as reluctant visits turned into a radical shift in both his health and his purpose. His journey is more than inspiring. It's a reminder that healing can be both precise and powerful, and that sometimes our greatest transformations begin when we least expect them. Let's talk about it. Once again, welcome to Beyond Adjustments. I'm here with Dr. Rich Benjamin. Welcome to Beyond
Thank
Adjustments.
you. Happy to be here.
So he invited us into his office. I mean, how awesome is this setup? We'll talk about this little doohickey here. I think this is kind of what our focus is going to be a little bit today, talking about the Gonstead and what makes it different and all that. So again, really, I appreciate you taking the time to jump into
My pleasure.
this session. It's awesome. So I want to start by kind of getting into, so for me, pain into purpose is a big thing.
Right.
And that's my life's motto, right? Like I believe God puts us in these situations where either we do something with it or we don't. So I want to talk a little bit about that. And so you started on a path to becoming an MD.
Yep.
But somewhere along the way, I believe you were shadowing your mom as a psych nurse. Is that accurate?
Well, my mom worked in a hospital.
Okay.
She is a psychiatric nurse practitioner.
Got it.
But before that, when she was kind of working her way through the ranks, and it afforded me access to hospitals and to be around it. And she's also a cancer survivor.
Wow.
So I would always go with her to her chemo treatments. So I've spent a lot of time in hospitals, or enough time to discern whether or not I wanted to be there.
Got it. And I would say your eyes were open to something a little deeper during your time and with the time you spent maybe doing some rounds with her and what have you, and just kind of maybe getting a different perspective on the system, we'll call it, or the medical industry or hospitals and what have you. So what did you see that kind of made you say, this isn't for me?
Well, it's a combination of things. And you have to remember, this is the late 90s. This is where medicine really changed. Up until that point, we really grew up kind of naively thinking that medicine was like, I grew up watching shows like ER, and I loved that show. And I loved Dr. Eric LaSalle. He was the hotshot surgeon that, he wanted to be the guy, because he was the smartest and the most technically adept. And, it's a very competitive thing, right? If you want to be known as the best surgeon. And I thought those guys were cool.
Yeah.
Right. I mean, and they were cool.
Yeah.
Right. And so they always drove the nicest cars, right? They always had the prettiest wives. And you know what I mean? As a kid, you're just like, I want that. I want that 500 SEL convertible Mercedes and live in a big house. And, when you grow up and you don't have much, and growing up in New York, life was difficult. My parents worked, both of them worked. My dad had 2 full-time jobs, and my mom was going to school to be a nurse and working to help support that. So it was hard. And I wanted to get out of that struggle, where you don't have the means to do everything, and everything is difficult when you don't have money. And I knew I wanted to be a doctor, and I wanted to be a successful one. And the most successful ones that I knew are surgeons. In fact, I used to build little model planes because I thought it would help my hand dexterity.
Okay. I mean,
right.
That's
right. So little details.
Sure.
And because again, I wanted to be a surgeon. So the guy who owned the hobby shop in my town is actually a retired surgeon.
You're kidding.
No. And I spent a lot of time talking to him. So I built a 124 scale B-17 Flying Fortress from World War II, cool. And I hand painted it. And he's like, hey, can I display this in my shop? This is really good. And I said, sure. And he's like, what do you want to do, kid? And I'm like, well, I want to be a surgeon. He's like, I am a surgeon. And I was like, really? He's like, yeah, I sat on the board at Albert Einstein. And, it's like, I did all this stuff. And I'm like, he's like, why do you want to be a surgeon? And I said, I don't know. I think it's a cool job. He's like, you like what it does for you? He's, is it the money? And I said, yeah, kind of sheepishly. He's like, there's nothing wrong with that. He's like, kid, I'm going to tell you something. We made our bones in the 70s and 80s. It was the Wild West. We could do whatever we want. He's like, I invented a mitral valve replacement technique. It's like, we could do that, right? Managed care came in, big hospital systems are in there. And he's like, and I quit. And I was like, okay. So I didn't really understand why he was telling me. He's like, if you're going to do it for the right reasons. And I thought to myself, I was doing it for the right reasons. And then the more time that I spent in the hospital, I could see just really how hamstrung the doctors were. Like they were always having to ask if the patient's insurance would pay for this, right? Or if the hospital would approve it.
Sure.
It's like, why am I going to school, accumulating $250,000 plus worth of debt, breaking myself to memorize all this? And it is competitive, right? You need to be the best of the best. If you don't have a 3.8 or 3.9, don't even try. So all of this work that these kids are putting in from high school, right? You have to have a good GPA in high school. You have to have a good GPA in college. That means you're not out partying. You're studying, right? You're taking the hardest classes that have a 80% failure rate, right? And then the curve. And so all of this stuff that people don't realize what goes into becoming a doctor. These people have dedicated themselves to excellence. And it's a very hard field, only to be told by some guy sitting in a desk in God knows where, be like, oh, we're not going to approve this. Like, who are you? To tell me what I cannot do. And then that's when the drug ads come in, right? So you see in the late 90s, like, ask your provider. So wait a minute, is he a doctor or is he a provider?
Right.
What is he providing you with? So he's just a provider, and drug companies hate doctors because they get in the way of profits, right? They don't respect them.
So true.
They don't respect them at all.
So true.
And so ask your provider if Cymbalta is good for you. Okay, what is it fixing?
And then what is it breaking at the same time?
There's always a side effect.
Absolutely.
Right? So I started seeing all of this. And my parents were hell-bent on their golden boy, their son that's, always the high achiever. I'm the firstborn, right? And then in our culture, it's like, well, that was my dad's dream, was to always be a doctor. And I wanted to fulfill that dream for him because, he grew up in poverty in Sri Lanka, difficult life, and he made it. He worked hard, but he always wanted to do that. And he always wanted me to do that. And he realized that I had the potential to do that. It was very difficult for me to tell them that I was not going to medical school. I didn't believe in it. I just saw the writing on the wall. I believed in what they were doing. I didn't believe that it was right for me, right? I just knew that my personality, I don't really do well with authority. And I don't really do well with being told what to do, especially if I don't respect you. If you've achieved something and you're in a higher position than me, I'll listen to you. But if you haven't.
No, that makes sense. And then also it's going to be experience against, a desk job of somebody that was trained for 4 weeks.
Right. So, or is reading from a manual.
Exactly.
So I was just like, I had applied to take my MCAT. My dad had paid for a study course. We couldn't afford much, so it wasn't a big thing, but I said, hey, I'm not doing it. And my parents flipped out.
Yeah. I get that.
It was a big letdown for them, but
I get that.
I went to work for a collections agency for a year where I kind of gathered my thoughts. So here I am. I graduated college in 2000 and just kind of, in 1999. And I'm just kind of bumming around at a collections agency making like, I don't know, $18,000 or whatever,
right.
$15,000, something terrible. My father being my father is, okay, let's see what jobs you can do, because you have a biology degree from St. John's University, you have a chemistry minor, you have a biology major. Like, what can you do with that? Because I was thinking, okay, go into research and maybe do something like that. Go study whale sperm somewhere in Antarctica. I don't know, something, something that, I had to do something. So I'm just like, my dad goes to the library, and this just shows you how times have changed. And he looks at this book, it's like, top 100 jobs of, in healthcare. And the number 3 top paying job was actually chiropractor.
That's actually awesome.
Right.
That it was top 3.
Even back then.
That's crazy.
It was like 60 grand a year. And so my dad, he's an accountant, is like, this is fantastic. We can get this boy out of my house. If he's making 60 grand a year, he can support himself.
Yeah.
So he comes back in and he's here. I don't even remember what number 1 was. I think it might have been like anesthesiologist. I don't know.
Right.
Or a surgeon or something like that. So he's like, look, why don't you try chiropractic school? And I said, absolutely not. I hate chiropractic. It's a bunch of charlatan, witch doctory nonsense. It's a bunch of quacks. Yeah. I had been to one before for a car accident. Didn't help me at all. Once the lawyer said, you're done, get out. Right. I had zero respect. I mean, I liked the doctor that took care of me. I thought he was a nice guy. But I thought that the electrostim and the ultrasound and the therapy that he did was far more effective than anything he did adjustment-wise. And I'll circle back to that, because that was a real failure, on his part, because I didn't understand a thing about chiropractic. I had zero education whatsoever, so if you just leave a patient to their own devices, and me being a patient, I'm going to come up with what I know based upon what I've learned. And my entire life, we are a medical family, right? My dad's like, but look, go down here and you can see, like, you have a degree, you can get an education, you can become some kind of doctor. I said, Dad, they're not real doctors. I don't want to do that.
That's a very common
Very common. I had it. Yeah. It's a very common thing. I was like, so he's like, just look at the information. So I started looking at the information from Life University in Atlanta, because they would send out to anyone who graduated with a bio degree. Somehow they knew, and this thing came to my house. So I had this whole big folder with all of the programs that they had. And so they had in there, very interesting, like side-by-side comparison of the credit hours that a chiropractor takes and a credit hour that an MD takes. And the first 2 years, the curriculum is the same. There may be some differences depending on the school you go to, but it's essentially the same. All the anatomies, the physiology, the chemistry, the biochemistry, all of that first 2 years is the same. And so I started thinking, because I'm always looking for a way to game the system. I did grow up in New York, right? So I said, if I go to chiropractic school here, my first 2 years, if I do these credits and I don't like it, I could always transfer out, because I had my eye on going to medical school in the Caribbean, like at St. George or something like that. It was a higher acceptance rate, right? And believe it or not, we are so desperate for doctors these days that they're importing people from everywhere.
Wow.
So let's imagine, right? I would have set myself up to be in that position. So I'm like, okay, Dad, let's go. And so April of 2000, we get on a plane and we fly to Atlanta, and I'm just not excited about this.
Like, whatever. Let's
just do it. Get my dad off my back. And we get down to Atlanta. I'm 23 years old at this point, and I'm like, I got to do something. And so I enrolled in Life University.
Nice. Is that the same as Life West out on the?
Yeah. So that's the parent school was Life University in Atlanta, and so they opened up Life West. And so while I was there, luckily enough, I had a friend I went to college with, Chris, that was going to school there. So I had a connection, and I wasn't completely isolated. And I started immersing myself in the culture and going to class and exploring Atlanta and doing that. And, when you first get there, they assign you a student doctor to take care of you. Like, everybody has to get adjusted. And I'm like, oh, here we go. I obviously went to the student clinic and I got adjusted at least once or twice a week. And it's just, whatever. It's either like a toggle, where they just adjust the upper cervical, or it's a diversified where they twist your neck. And I thought to myself, I'm like, this is just monkey business. I mean, this is just really, I mean, I can do this now. I can twist people up. And sure enough, we would walk up to each other and be like, hey, let me set up on you.
Yeah.
And we would do all that.
Yeah.
I didn't think it took any great skill. So it did nothing to really, bolster my
confidence,
my confidence or my admiration. And I was just like, cannot wait to get out of here. So first, it's all in quarters. So first quarter goes by, and I'm like, okay. Second quarter goes by, and at the end of the second quarter, I'm thinking to myself, I'm like, man, I don't know what I'm doing here. And one of my buddies is like, what's up with you? You're always like in a bad mood. Now, at this point in my life, like I've been dealing with some symptoms, and it wasn't that it started when I went to school. It had kind of been plaguing me for a while. So I developed insomnia. So I wasn't really able to sleep. I'd be up till 2-3 o'clock in the morning, sleep for a couple hours and get up and just go, So, and I had really developed like a very nagging knee injury so to the point where like my right knee didn't really work very well. And then if I sat for too long, both of my knees swelled. So we go to church and I couldn't kneel. My mom would always be like, kneel. I'm like, I can't kneel, so it was just pain. And I was like, I don't know what to do with this. And of course, when you don't have insurance and you don't have any money, you don't get it checked out.
Yeah, for sure.
I had torn my rotator cuff on a heavy bench press. And so I did go to that doctor, the chiropractor, and he actually suggested I go get cortisone shots, which I did. Right. And I was doing a little therapy, but after the first session was like $300 or $400, I'm like, and I'm done.
Yeah.
I'm like, I'm going to have to do this myself because I basically had to put that on a credit card to pay for that.
Yeah.
And so I've got this bum shoulder that doesn't work. My shoulder's like, and I can't train. And, when you can't train, you can't exercise, you start putting on weight and, you're just really kind of miserable. And I was just really in a bad mood. I was like, man, I'm getting adjusted by everybody I see in this place. Like I probably get 2 adjustments a day, really. Cause I would just walk up to people and be like, can you adjust me? They're like, did you get adjusted today? I'm like, no, I would lie. So that just to see if they would do something to help me feel better.
Yeah.
And right then and there, they would find a table, they would adjust me. I'd go to teachers. Can you adjust me? Sure. We'll check you out. Adjust me. Didn't change. I mean, I still wasn't sleeping. He's like, hey, I just found this technique called Gonstead. And I'm like, what's that? He's like, well, we don't get it.
Who's he?
Oh, my buddy.
Okay.
So my buddy who was like asking me why I was so miserable.
Got
it. My buddy Dave. And I was like, Gonstead, I'm like, we don't get that until we're like way later on in school. He's like, yeah, but there's a doc by the name of Mike Stewart, and he's got a practice up in Kennesaw, and he's a Gonstead doctor, and he's doing a workshop on Monday night. Do you want to come check it out? I'm like, what's the difference? He's like, you'll see. I'm like, okay, I got nothing to lose at this point. So following Monday night, we go up to Dr. Mike's clinic. And the first thing that struck me when I walked in the clinic was there's a lot of medical stuff around. There was a lot of posters of spines and pictures of the intervertebral disc and anatomy chart and like, where like the nerves go and things like that. I'm like, this is strange. More often it was always like, just pictures of like the big idea and innate intelligence and all this kind of sounds kind of cultic talk of chiropractic, when they talk about innate intelligence. Now that I'm in it, I understand how important it is. But from an outsider looking in, it sounds very like Hare Krishna. Let's like sit in the field with thumb symbols and hold hands. You know what I mean?
Yeah, I do.
And so, and again, I had from having zero background and I am not into this stuff. And so Dr. Mike comes out and the first thing he's doing is he's putting up x-rays, and these are the old school x-rays. And the first thing that struck me about the x-rays is that they were long. So they were full spine films, not sections, right? And the fact that he even looked at an x-ray in the first place was impressive. I was like, this dude takes x-rays. Why does he need x-rays? Right? So he's putting up x-rays and he's talking about all these cases, and he's talking about like asthma and migraines and blood pressure issues and AFib and constipation and bladder issues. And I'm just like, what?
Yeah.
You know?
Yeah, this guy's off his rocker.
I'm like, what is he talking about this stuff? He can't touch this stuff.
Right.
He's not supposed to diagnose, right? What's he doing? And he's not. It's just what the patients are telling him their symptoms are. And he's like, how's he taking care of all this? And he's like, so I did this, and 2 days later, patient's fine. And I'm like,
Yeah.
what?
Yeah.
I mean, it just sounded like,
Too good.
nah,
Too good to be true
there's
kind
no
of
way.
thing. Yeah.
I'm like, chiropractors don't fix that.
Right.
So then we start getting to working, and everyone's taking their shirt off. Not the girls are in gowns, but the dudes are sitting. I'm like, why are we taking our shirts off? Right?
That's really weird.
Yeah. So then they all start sitting in the chair, and they take out, luckily I have one of these. They take out one of these instruments, these scopes, right? First of all, this one is from 1960. So the new ones are kind of plastic and terrible, but the old ones work really well.
Okay.
So they start running it down their spines, and they have a little pencil, and they're marking where they find stuff. And I'm just like, what are they doing? I mean, this looks kind of like a dowager rod. I'm like, is this some dowager rod? I'm like, can I find water with this?
Right.
So I'm like running it down, and they're like marking where the patient is, and they're like poking and prodding, and they're taking a lot of time. They're like, yeah, I feel inflammation here. There's some swelling right here. The vertebra's stuck going this way. And I'm like, whoa,
Wow.
this is pretty in depth, right?
Yeah.
And then they start setting up to adjust. And first thing I noticed is there's no twisting. There's no rotation. So people start working up on me, and they start poking and I'm like, that hurts. Like, and they're like, good, this is where it is. And then they set up on me, and I was like, nobody moved anything. We were just practicing. And it was very intrigued. I thought this is much more in depth than anything I've seen up until this point. And I just thought, well, it's early days. Maybe they teach us this later. Come to find out, they don't teach you that at all. There's one class offered in Gonstead through the entirety of school, because school's mission is to give you a bag of tricks.
Got it.
That's their quote. We want you to learn everything, so you have everything in your bag of tricks that you can use. And I'm just like, that makes zero sense to me. That's called being a jack of all trades, master of none.
Why not specialize, right?
Yes.
Yeah.
Yes.
Yeah.
When patients come in, like, I saw my specialist. They have, they're so proud that they went to see a specialist. This is how warped our culture is. Do you really think it's a good thing to see a specialist? That means you're really jacked up. But it carries weight when you specialize. Yeah. It means you've done extra work, extra schooling, extra effort into helping a patient as best as you can.
Sure.
So it has value.
Yeah.
So yes, I like specializing. And so I thought, okay, well, this is not something that we're going to learn later. And then once I got into it, I realized just how amazing it really is. So I went up to Dr. Mike at the end of it, and I said, hey, doc, can you adjust me? And he goes, no. So it's the first time I've ever been rejected. I'm like, okay. He's like, do you have x-rays? I'm like, nope. It's like, first thing you're going to do is you're going to either bring your x-rays, or I can take them for you here, and we'll check them out and see what's going on. So give me a call tomorrow. We'll make an appointment. I'm like, okay. So called him, made an appointment, walked in. On my intake sheet, I filled out my name and my address and my phone number, and that's it. I thought, okay, let's test this guy. See what he knows.
So you didn't give him like any details?
None. He's like, you having any issues? It's like, yeah, I'm a student. I'm just always jacked up. That's really what I said.
Yeah.
Like, all right. So I sat there, shirt off, ran the meter, put a couple of marks on my back, started poking and prodding. He didn't say a word to me. He just said, okay, let's go take some x-rays. Shot the x-rays. He's like, give me a second. I'm going to go process them, because you had to put them in the machine and process them in a dark room back in the day. Now everything's digital. And so brings them out, puts them up. He starts marking them up, and he looks at them for a second. And he turns to me and he goes, you have a broken tailbone. Did you know that? I'm like, no. He's like, you broke that when you were a kid. You have a compression fracture at L5. You have 3 compression fractures in your upper back. He's like, did you play football? I said, yes. And rugby. And he was like, yeah. He's like, you have a reverse curve in your neck. You have a lot of pressure under the base of your skull. So he goes, judging by that, I would say you don't sleep very well. You're a little moody. You have a bad right shoulder. And let me guess, you've got pain in your legs, probably around your knees.
Wow. Literally pinpointed.
Yeah. And my jaw hit the floor.
Everything.
Yep.
That's crazy.
And I was like, how in the heck do you know that?
Yeah.
It's like, it's right here.
That's amazing.
He's like, look, he said, it's very, very simple. This thing that your soul lives in is nothing more than an organic machine. It undergoes wear and tear. Every fall, every step you take, everything you lift, every ride that you take in the car and the car shakes you, traumatizes your body, either micro or macro, right? Either little or big, and your body keeps score.
Yep. Keeps track of all of it.
If you don't correct it, it's just going to go get left unchecked and going to get worse and worse. And I was like, ding, light bulb. That makes a lot of sense. He's like, this is simply structural correction. We've got to correct the structure, because if we correct the structure, we improve the function, because structure determines function.
Yeah.
And that is the very simple basis of chiropractic. That is chiropractic in a nutshell, or it should be. Correct the structure to improve the function. That's it. So he's like, okay, let's get to work.
Yeah.
I'm like, cool. So I went and laid down on the side table and I crossed myself like this because I was ready to get cranked.
He's like, what are you doing?
He's like, no, get up. We're not doing that.
Yeah.
He was like, get down here. So he's like, okay, big boy, kneel. So I knelt down on the table. So knees here, top of my chest here, facing the paper, butt hanging out in the air. And I'm like, this is the craziest thing. I'm like, what in the, I'm like, what is happening here? I thought to myself, if I hear a glove snap, I'm out. You know what I mean?
Yeah,
so
I do.
Right? I'm like, I don't want to hear that glove. I'm like, we're fighting.
That's hysterical.
So he's like, okay. So now I'm just like, I'm rigid, right? Because I don't know what's going on. I'm tense.
For sure.
He's like, relax.
Yeah.
And he was from Boston, and he was a big guy. He used to power lift. And I thought, oh my gosh, this guy's going to murder me, right?
He's going to break me.
So he's like, just, he put his hand on me very softly, very gently. He's like, relax. He's like, look, if you tense up, this is going to hurt really badly. So you got to relax. So I'm like, okay. He's like, drop your belly down. And I felt him put his hand on the small of my back, and he put a little bit of gentle pressure. And he was like, ready? Before I could even answer, wham! And I don't know what happened exactly, but like what it felt to me was like just liquid fire just went down my leg, like a zing, like a lightning. And before I could catch my breath, he adjusted my upper back, and it made the sound like, I mean, it was the most awful sound, right? I was like, sound like spaghetti snapping. And he's like, okay, get up. And I thought, I can't move. I'm paralyzed. This man has killed me.
Yeah, he broke me.
He broke me. Broke me. It's awful. So I got back up. I am drenched in sweat. And he goes, you okay? And I'm like, I don't know. Because I was like vacillating between extreme panic and extreme anger. And I didn't know what to do. I didn't know if I wanted to smash him, but I didn't know what to do. So he's just like, go ahead and squat. I'm like, I can't squat. My knees, doc. These are bad. He's like, I haven't been able to squat in 2 years. He's like, just shut up and stop whining and squat.
Yeah.
I squatted all the way down, all the way up. Not a pop, not a crack, not a pain, nothing. Nothing in my knees. And I'm kicking him. I'm like, you gotta be kidding me. You gotta be kidding me. He's like, what do you do? He's like, we got more. We'll talk after.
This is just the beginning.
Yeah. So he sits me down in the chair. He pulls me back, puts my neck up, set my C2, tells me to the side, set my C1. It was like, I saw stars, I saw lights, like everything just opened up. I got a little dizzy, I got a little nauseous.
Which makes sense.
Right, because I've been so locked up for so long, all those head injuries from collisions of football, because, we led with our face. We didn't leave, we, of course, all right, that's what we did back then, right? Nobody knew about CTE or anything like that. And so after I got my bearings, he's like, okay, that's it. He's like, now look, you got to go home and you got to ice this down. You are very inflamed. Let me know how you're doing in the morning. I don't remember how I got home. It was like in a daze, driving down 75 towards Marietta in Georgia. And I just don't remember that drive. And I have a great memory. I cannot tell you what that drive was.
Wow.
Got home, just didn't feel good, got into bed and went to sleep. And I slept for 16 hours. I missed my entire day of class.
Crazy.
The next day, I get up, I'm panicked because it's like 2 p.m. And I call him and I'm like, Doc, is this normal? Was I in a coma? Like what? He's like, you're not in a coma, you weirdo. He was like, no, your body needed it. He's like, I'm going to write you out for the rest of the next 2 days. You need to stay home, eat, sleep. Boy, did I catch up on some sleep.
Wow.
It was amazing. I went back to him a day after. He checked me. He's like, you're good. He just had to adjust my neck. He's like, okay, we'll stay on it. That adjustment changed my life.
Yeah.
And that's when I knew that chiropractic was more than glorified therapy. That chiropractic can actually not treat, because with symptoms, you treat the symptom. I knew that chiropractic was corrective.
Yeah.
And that was a big revelation,
Yeah.
because everybody treats symptoms. Your functional medicine, your massage therapist, your PT, your MD, your acupuncturist, all of them treat symptoms.
Yeah.
Chiropractic is the only healthcare profession that looks to correct causes.
Mm-hmm.
And I can get behind that. I want to know the truth.
Yeah. I love that. I love that.
And that's what got me hooked. And so I begged him, I'm like, please let me work for you. And he's like, get the heck away from me, kid. I don't have time for you. I showed up every single day.
Yeah.
I took out his trash. I cleaned his toilets. I folded and laundered his gowns.
Yeah.
I organized his front desk. I'm like, what can I do for you? And eventually he's like, okay, I see you're serious. Let's go. And I became his first intern.
Oh, wow.
Yeah.
That's cool.
I mean, that man changed my life. I mean,
I mean, that's amazing. That experience alone, like, if that's all you had.
Yeah.
Seriously, like that's phenomenal. So
go ahead.
So the first Gonstead adjustment literally changed the entire trajectory
of my life.
Of your life.
Yes. Hands down.
Unbelievable.
Hands down.
Unbelievable.
It's the reason that a kid from Long Island, New York is been here at Fort Mill, South Carolina for 20 years and loves it. And I mean,
wow.
Why am I
here? Have you been in this office the whole time?
About 15 years here.
Wow.
15, yeah, it was 15 or 16 years in June.
Wow.
Yeah. Yeah.
That's amazing.
From that one adjustment. And
that's amazing.
And that's that ripple effect.
Can't think of another word. Like, that's just phenomenal.
So that's that butterfly effect. And BJ Palmer would always say, it's like, never underestimate the fact that one small thing today can have massive, and I'm paraphrasing, massive repercussions tomorrow. And that one small adjustment at the end of 2000, maybe it was 2001, it was probably 2000, has changed. 25 years later, here I am, that's doing the same thing, loving it, passionate about it.
So good.
Can't think of doing anything else.
So good. So good. Okay. Let's get into the technique. I could talk about your story all day, man. Unbelievable. Thank you for sharing, by the way.
You're welcome.
But I want to talk a little about the technique, the systems, the patient success, a couple of those things. And so, including myself, and I'm sure a lot of our listeners, Gonstead, right? That's a new term for me. Like, I see my chiropractor. I believe in corrective care, right? I see my kids see a scoliosis specialist who's a chiropractor as well, Clear Life Scoliosis up in Huntersville. I'm seeing the corrective piece, right? And kind of addressing the root cause of things. I see that. I'm not familiar with Gonstead, right? Mm-hmm. So give us the 101, kind of explain to us just high level for us laymen what it's all about.
Well, first we have to talk about who Gonstead was.
Okay.
So Dr. Clarence Gonstead started his practice in 1923.
Okay.
In a little town outside Madison, Wisconsin called Mount Horeb. And you have to remember, at that time, these guys were only trained to just adjust really the upper cervical, which is like the skull, C1 and C2. He had the foresight to think, well, as specific as we are to those areas, why can't we do that with the rest of the spine? And he had training in being a mechanical engineer. And I really don't know why he was gifted with this, but this guy was just so far ahead of his time, right? So he started applying these principles. He did a lot of research. He would go to like Lincoln College in Nebraska and look at cadavers and realized that the pelvis was 3 separate bones, 2 hips and a tailbone. Whereas in Gray's Anatomy, it was all one solid piece at the time. You know what I mean?
Yeah.
So like he really developed a system of how to correct it, how to correct people. And as he started getting popularity, he had to move to bigger and bigger clinics because he had a reputation of being the guy that could fix what no one else could fix. In the 60s and 70s, the Mayo Clinic would refer him patients that they couldn't help. This is the Mayo Clinic.
Wow.
They don't talk about that anymore, right? Because no MD would be caught dead referring to a chiropractor, at least the old ones. You know, maybe once the old ones die off, the new ones will be a little bit more enlightened, you know, because there's room for everybody, right? And so he eventually in 1964 built a massive, I think it was a 13 or 14,000 square foot clinic in a cornfield that he paid for in cash, right? Outside of Mount Horeb, which is still there today, the Gonstead Clinic. And it is incredible. And it's like, if you wanted to get help in the 60s and 70s, you went to see Clarence. You went to see Dr. Gonstead. And there were two brothers, Alex and Doug Cox, that went to work for him and begged him to kind of teach the system. And so he started teaching the doctors and getting it to spread. And then these guys have taken this, and other doctors and Dr. Troxel and all of these guys just started teaching seminars to get this out. In fact, at Palmer College for a long, long time, a majority of their adjusting was Gonstead up until probably the early 2000s. And it's now changed, sadly, a little bit. But the Palmer method, 80% of it was Gonstead. Wow. You know, but he came up with a system of meticulously analyzing the spine and based upon that information, deciding what steps to correct the spine. And then he would leave it alone, which goes against this thing, what everybody thinks. It's like, oh, once you go, you got to go once a week for the rest of your life. It's amazing they don't say that about blood pressure medication.
Yeah, right?
Oh, once you take blood pressure medication, you got to take it for the rest of your life. So I'm not going to take it. Or how about, oh, once you brush your teeth, oh, you got to brush your teeth for the rest of your life. You see the insanity of that? Right? It's like, oh, I was really fat, but I've dieted. Now I got to diet for the rest of my life. Yeah, if you don't want to be fat, that's what you got to do.
Yes.
You don't stop doing the things that make you successful or keep you optimal or keep you functional. This is what they say. But I understand the point. Yes, I don't want you coming here twice a week for the rest of your life.
Sure.
Right? I would like to get you to a place where we can maintain it, depending on your activity level. If you're very active, like I am, I get checked once a week.
Yeah.
I know that's what makes me better. That's what benefits me, keeps me healthy, keeps me seeing 400 to 500 patients a week, right? And there's a limit on that. But if you're not that active, or you don't need it, or you're pretty stable, okay, maybe it's every 2 to 3 weeks, or every month, maybe longer, depends on you. But at least you're maintaining it. But you do have to maintain your vehicle. You've got to maintain it.
Yeah.
And the more miles you put on it, the more often you have to maintain it. It's just that simple.
Yeah. Yeah.
So he really focused on correction. They used to do blood work and urinalysis in his clinic as well, because he was really interested to determine that if the patient's symptoms were caused by a herniated disc compressing on a nerve, that can be corrected. So he developed a system of analyzing the disc, because he realized that subluxation happens at the disc level. The intervertebral disc, or the soft tissue between the bones, is the only thing that can compress the nerve. And how do we analyze it? How do we fix it? And he's like, if you twist it, you hurt the disc. Yeah, I've got this little model right here. I'll show you. So here's the disc. Here's the spinal cord and the spinal nerves. We get injured, boom. There's your bulging disc. There's your herniated disc. Surgeons will go in there and chop this off.
Really?
But here's the problem. This is still compromised. When it's stuck this is like a door jam. This doesn't move. So the only way the disc gets any type of fluid exchange is from movement.
Okay.
That's why movement is so important.
Okay.
This does not have a blood supply, because God was very smart, right? And realized if you put a blood supply to this disc to get injured so often, you would tear a micro blood vessel and you would bleed internally.
It's like God didn't make a mistake. It's
No.
crazy.
I mean, just nuts.
That's insane.
And the design of this is incredible.
Yeah.
How each vertebra here interlocks perfectly to allow for back and forth movement.
Yeah.
So human beings are very strong in flexion and extension. We are very weak in rotation. In fact, rotation is the fastest way to tear the fibers in the disc.
Okay.
So why are chiropractors rotating spines?
Interesting. Interesting.
So if you read your physiology books and your anatomy books and you realize that the most causation of destruction to the disc is rotation, why are you rotating? I'm just asking questions.
Yeah, it's a good question.
So Gonstead figured that out. He figured out, okay, how do I get that disc material back in there? Well, we have to adjust this deeply, posterior or backwards, anterior, because the disc does not misalign any other way. It misaligns posterior or backwards. So we need to push it anterior or forward. And we do that over time. We can actually reposition the disc, get it healthy, and restore the disc.
Okay.
And we can restore the function of that nerve because we can remove the pressure on the nerve. At its very essence, all chiropractic is removing interference on the nervous system of the body.
So it can do its job.
Yeah. There was a study in 2006 by Dr. Suh from the University of Colorado that said a dime's weight of pressure on a nerve, or 10 millimeters of mercury, will decrease nerve output by up to 60%. And it's imperceptible. You cannot feel the change of atmosphere of 10 millimeters of mercury. So how important is it to take that pressure off of that nerve?
Very.
And so Gonstead figured it out. And so that's the difference in the Gonstead work over everything else in chiropractic. Number one, no rotation. So everybody's really afraid, oh, if you adjust the neck, can I get a stroke? Let me address that. First of all, it's a 1 in 12 million chance. Tylenol is thousands of times more dangerous for you than a chiropractic adjustment. Okay? It actually puts more people in an emergency room than a chiropractic adjustment does. So you'll have a better chance of getting eaten by a great white shark. Okay?
Yep.
That being said, if you want to be absolutely safe, don't twist necks.
Yeah.
And it can be done the right way. So we adjust the neck with the patient in the chair, the nose stays in the midline, the head's flexed, and it goes up. And there's no way to involve any of the arteries here because we do not rotate. Gonstead himself figured that out 60 years ago.
Wow.
So he said, you boys are adjusting too hard and too much force and too much rotation.
I see some chiropractors that I would never step foot into their practice when they'll put somebody on a table, wrap their neck with a towel.
Yeah.
And I mean, I see them yank with all their might. I'm like, that can't be good. Like,
it's not.
Yeah.
It's a good way to rupture a disc. And this has happened to so many people. Like, I was just listening to a podcast with Dave Mustaine and Sean Ryan. And Dave Mustaine is the lead singer and guitar player of Megadeth.
Okay.
And he's like, the first thing he comes out and says, chiropractor broke my neck.
Wow. Yeah.
And there's a lot of stories of that. There's a lot of stories of that with people that have done that. Is there a danger to getting adjusted? Yes. Right. There can be.
There's
right?
a danger for going to your pediatrician. Yeah.
You know, it's far safer than someone cutting your baby's ears with a knife and putting a tube in, you know?
Yeah.
Like people will volunteer their children for that.
Yeah.
But they're loath to bring a baby to a chiropractor because, oh, they may hurt them. Really, the pressure to adjust a baby is just literally, it's that.
It's nothing.
It's nothing.
Yeah.
And you hear a little click. It's just, we're so captured by fear of the unknown. And that's why people hate chiropractic.
It's also brainwashing. I mean, like,
very much so.
So we're taught something, right? As you know, throughout our lives, and we're taught to believe it, like blindly.
Yeah. But there's no one way. There is no one path to success.
Yeah.
You know, there is no one path to do this.
I love that you said that.
You know, there's multiple avenues.
Yeah.
So you can't be so close-minded and compartmentalized to be like, trust the science. How'd that work for us in COVID? Yeah. Keep trusting it.
Yeah.
Right?
Yeah.
You know, so it's like, no, science isn't stationary.
Yeah. I agree.
100% science evolves.
Yeah. Yeah. I mean, chiropractic is how old? What, 120, 100?
Chiropractic is 5,000 plus years old. And I'll tell you what.
From the Palmer age.
130 years old.
Yeah.
So 1898 was the first chiropractic adjustment. But 5,000 BC, Hippocrates, the father of modern medicine, would put mud on people's backs. And where the mud dried the fastest, that's where they would manipulate or adjust.
Interesting.
Why is the mud drying fast? Because that's where the inflammation is. Inflammation is heat.
It's heat, yeah.
That's what that scope picks up.
That's insane.
Heat.
I've never heard that.
No. Why would you?
Yeah. That's cool, though. That's a really cool fact.
Right.
Yeah.
Ancient China, bone setters. Ancient Japan, bone setters. Human beings have been doing this for a long, long time.
Wow. Wow.
It just took D.D. Palmer to put it together, and then his son B.J. Palmer to bring it to the masses. You know, the world owes those two gentlemen a great debt.
Yeah.
And then Clarence Gonstead for taking chiropractic and putting a scientific approach to it. And it's still ongoing.
Question for you. Why do you think something like this methodical gets overlooked? Like, are we trading long-term results really for just these, I don't know, quick fixes in chiropractic care?
Yes, we are. I'm probably going to get in trouble for this, but honestly, you know, I don't care. The truth
I want your truth. I want to know what you've seen, and I want you to be completely
I'm not
honest.
laying blame at the schools, because the schools at the end of the day is a business. Okay. And I understand their job is to churn out as many students as they can. This is very difficult to learn. And I will speak about society. I think the kids of today are very spoiled and very entitled, and they want the Ferrari now, and they don't want to do the work.
Yeah.
You know, this took me, I cannot tell you how many thousands of hours I've spent trying to do this. Gonstead said, if you haven't given 10,000 adjustment, you're not good. Once you've given 10,000, you're good. So it's the reps.
Yeah.
And you have to have the intent. It's very difficult to learn, because we want that instant gratification of the pop, right? We want to put our hands on a patient, move the bone, and hear that audible, you know, oh, we did something.
Yeah.
Instead of learning how to do this the correct way, which in order to do this work, you have to really embrace and love failure.
Interesting. In order to do anything successfully, you have to embrace failure.
This will really bring it up, though. I mean, I can't tell you the frustration level is when you look at everybody else in school and they're just manipulating and getting things to pop, and they're walking around with their chest up and how proud they are that they can twist people and make a sound. And here you are as Gonstead guys and girls, and you're just sitting there like, oh my gosh, I can't move anything. I'm terrible. You know, you have to have intestinal fortitude to just say, I am going to fail and fail until this clicks and I get right. And so, you know, there's pressure from your peers because you're not good. There's pressure from your time is limited because you're only in school for 3.5 to 4 years. And then you have to come out and you better bring the goods, you know, which is why I basically sacrificed all my time to learn this and work, you know, thank God for working for Dr. Mike. And then when I came here to Charlotte, my another mentor of mine, Dr. Ozzie Mark, really showed me the ropes, and I worked my tail off, right? I would take a cushion like this and I would sit there while I was watching TV, and until my hands were sore.
Yeah.
Just to learn how to adjust. Yeah. I mean, so if you're not willing to do that if you're not willing to do that kind of work, you'll never be good at this. You'll never be okay at this. You know, you have to do the work. And it's very disheartening for a lot of kids. It takes that special person to do this.
Well, I think also now, especially because of all this kind of instant gratification and overnight prime deliveries and same day prime delivery mentality, we want the thing now.
Right.
And to become an expert at something, it's never going to happen like that. There's no such thing as a prime approach to becoming an expert at Gonstead or chiropractic in general.
Right.
But that's our society today.
It is.
My kids get, you know, frustrated when I don't give them what they want or ask for the second they ask for it. So you teach them patience, right? Hey, hang on a second. This will come when this happens. But that doesn't exist today.
No.
Right? So what you're saying as far as adjusting 10,000, you're not, you know, that alone is going to scare off most everyone that is even looking into chiropractic. Like, I'm not doing Gonstead. That's
right. And then, you know, so the thing that scares off the kids now is the debt. They don't want to get in debt because all they worry about is student loans.
Yeah.
Oh, I don't want to get student debt. When did this become something to worry about?
Right.
I mean, you got to spend money to make money.
Yeah.
Why are you worried about that? What about the patient? So when did we lose? When did we lose that?
Yeah.
Shouldn't your patients get your best? Shouldn't they get the best that you can give? Or are you just in here just, you know, cracking spines and collecting a paycheck?
Yeah.
Get off the field.
Yeah. I agree 100%.
If you're going into school and you're not there to be the best you can for your patients, then what's the point?
Yeah.
Gonstead Gonstead is very specific in its analysis. It's specific in the way that we give the adjustment. Like I said, it's skin on skin. Ladies are in gowns. Guys have their shirts off.
Yeah.
We use that meter because we want the objective criteria to see, okay, there is nerve pressure here by way of heat. We can see that because that's what that meter picks up. We use x-rays every single time because to see is to know, not to see is to guess. Adjusting somebody without x-rays is to me like a surgeon operating blindfolded. I don't care if you're Ray Charles. You ain't feeling it.
Yep.
You get a 300+ pound patient in here, you're not feeling it.
Yeah, I get
so
that.
Yeah. The intent of it is what I love, because the intent of it is that when I put my hands on a patient, it's corrective.
Yeah, that's good.
It's not therapeutic. It's not there to make you feel better.
It's also, so yes, it's corrective, but it's corrective first, preventative second.
Yes.
So that's what I love about chiropractic care in general. And people don't understand that. People will see chiropractic care just as a, like a PI approach, right? Personal injury. You get into a car accident, you go see a chiropractor. That's the kind of widespread view of chiropractic, but it's really, really is corrective. I mean, I've experienced it myself. My kids experienced it. But it's also preventative.
100%.
Because it gets you into a place, and correct me if I'm wrong, where now your nervous system, the main thing in your body that communicates with every part of you, that's connected to the main part of you that makes you function, is now in a place where it can do what it's supposed to do and prevent certain things from happening.
It does also, the Gonstead work I've noticed has made my patients more resilient to injury. Yeah. They'll get into car accidents and I'll take x-rays afterwards. I'm like, nothing shifted.
Yeah. That's insane.
Which is crazy.
Yeah.
And I wouldn't believe it if I didn't see it.
Yeah.
So I'm certainly not making that claim that it's there for everybody, but it absolutely builds resilience.
Sure.
I'm pushing 50 years old and I'm still working the way that I want to work. I still train in the gym. I still do all those things. I can still squat without pain.
Yeah.
I'm doing all of these things because I get myself checked once a week without fail.
That's good. That's good. And we are starting to run out of time.
I know.
Dude, I could be here all day with you, but I want to cover a couple of more things, and we honestly don't have time to cover everything.
Well, hit the important stuff that you wanted to get at.
Yeah, so I think one of the things that I wanted to touch on, so there's a few things here. Maybe we'll leave the kind of vision and legacy and future goals for another time. Maybe you'll be back on the show and we'll talk about that. But
love to.
But let's touch on your clinic culture and maybe some family dynamics to just kind of explain your setup and situation here. But your wife, and tell me how you say her name?
Jenica. Yeah.
Runs your clinic essentially.
And my life. Behind every successful man is a very, very tired woman.
Yes. Preach it.
So I have been absolutely blessed with an amazing wife who loved chiropractic and loved Gonstead Chiropractic before she loved me.
Oh.
She used to work for a friend of mine, and I thought she was amazing. And he wanted to join my practice to learn from me. And I was like, you can join my practice, but I don't have time to teach you, dude. You got to immerse yourself in the culture. I really wanted her to join my practice and help run my front desk as well. And, one thing led to another, and it was just really like a God thing. Neither one of us was really looking, but, God was like, here you go. And, it has been the greatest benefit to my life and to my practice to have her here, because she loves Gonstead Chiropractic. She's a benefit of Gonstead Chiropractic, and she's so passionate about it to bring it to our patients. And she wants just this clinic to do well.
She's like the heartbeat of the clinic.
She is.
Yeah,
she is.
I love that. So let me ask you this, because couples who work together, it's not easy.
No.
So how do you balance kind of running a growing practice as yours while really staying a solid couple and being the parents, and not just the parents that you need to be, but also who you need to be for each other? That's important.
There is. I'll tell you, I don't know how other people do it, but this is how we do it. Number one, we're unified in our mission. Our goals align.
Yeah, that's very important.
In a lot of things.
Yeah.
We are very similar in a lot of things, but enough different where we can complement each other. When she powers up, I stay calm. When I power up, she stays calm. So there's a balance there.
Absolutely.
The second thing is we stay out of each other's lane. I do not dare to dream to tell her how to do anything.
Yeah.
And I submit to her authority. you know, which is tough because, you know, when you are a doctor and you've worked hard, and make no mistake, you can tend to have a little bit of a power trip, especially when you have success. And I want to be like, you know, I want to come down like Moses off the mountain. You know, I want to throw the tablet down.
Yeah.
I have spoken,
Yeah.
you know, that don't work.
Yeah.
I stay in my lane, right? And I submit. If she tells me to do something, or if I'm not doing something right, I trust her and listen to her, and I do it for the most part. Sometimes I do get my feathers ruffled.
Yeah.
And sometimes there are extenuating circumstances, because for me, I always put my patients first.
Sure.
You know,
Yeah.
I don't care how many people are waiting out there.
Yeah.
You can wait.
Yeah.
Because I am going to take this time. Dr. Gonstead said there is nothing more important in the world than that patient in front of you. And I took that to heart. You know, so if somebody needs the time, they're going to get it. And every single one of those people out there, they will get it.
Yeah.
I will make sure you leave here. You will know that you are loved, that you're appreciated, you've been taken care of, and you're going to send you out into the world better than when you walked in.
That's so good. So you
got kiddos?
Probably a dog, maybe.
And a dog and a German Shepherd.
Sports practices, all the things, right?
Yeah.
How has being a dad really shaped how you think about maybe healing, legacy, purpose, all that? Because you obviously you walked into this without kids.
Yes.
Did that change any of your perspective or enhance?
I will say, with all honesty, it has really taken away from my practice, because it shifted away when I was so 100% committed before kids. This was my baby. And I think that now I'm here Monday through Thursday from 8 a.m. till 7+ at night. I know my kids get 3 days. It is hard as a dad, you know, when I think about like how little time I actually have to spend with my kids.
Yeah.
You know, and how draining the work is and how tired you are at the end of the day. You know, I see my kids for maybe 30 minutes at night, Monday through Thursday. And, you know, I need recovery time on the weekends. So it's hard for me to do that, but we try, you know, we try as much as we can.
Sure.
And we really have to do the quality over quantity, you know.
Let's talk about the culture. So what systems or maybe habits with your team, or not just your team, but within yourself, that you might have put in place that helped you maintain maybe consistency in your clinic as you grew?
We have good protocols on how we take care of our patients. As far as like how we talk to them, we want to greet everybody who walks through the door as if it's their birthday. You know, we want to be like, we're happy to see you. I hate walking into a medical office and they're like, insurance, and the girl's chewing gum and she's not interested.
That sliding door.
Like nothing makes me angrier than that. You know, I believe in customer service, right? I believe in, you come here, this should be an oasis. We've got coffee, we've got water, we've got sparkling water. We got this stuff to be like, hey, come out from your day, sit down, listen to the music, chill.
Yeah.
And we want to treat everybody as if they're special, because they are special to us.
Yeah.
And then we want them to understand that this is a referral-based practice. I don't really advertise except through word of mouth. And we just want them to feel comfortable and trust us that anyone they send here is going to get that same treatment.
Okay. So that's actually a good segue in what I want to talk about next. You said you're referral based. So I want to talk about the marketing aspect, the growth, maybe staying grounded. So you're obviously thriving in Fort Mill.
Yes.
This is probably one of the largest chiropractic offices that I've walked into in Fort Mill. And so it's not by accident. Obviously, it's not by accident. You're doing something right, Dr. Rich. So I guess my question here would be, you don't market, so the work and the results speak for themselves. Are you saying is this been the case the entire time, or is this now happening that it's become more referral based? Like, or what approach did you take to marketing essentially?
It was the way the entire time. You know, when you come out of school, like back when I came out of school, they didn't tell you how to do anything. They told you to hang a shingle.
Yeah.
So I found a company called AMC that really taught me how to talk to patients, and they were amazing. And I cannot recommend them enough for guys that are starting out. And there's a lot of chiropractic marketing people out there, right? But really what AMC taught me is how to connect with people on a heart to heart. level, and find out what their need behind the need is. Like, why are you here?
Yeah.
And I think that when we just strip down all the crap and we just talk, that's really been the key to my success, is to be like, hey, how can I help you? What do you want to do?
Yeah.
Because your goals are my goals.
Yeah.
And that's what's got people come on. Because look, it's not easy to ask somebody to commit to a plan of care. It's a time commitment. It's an effort commitment, because you're driving through Charlotte traffic to get down here. Fort Mills exploded. And it's a financial commitment.
Of course.
Right? I'm asking you for all that, but it is a commitment. And if you want me to commit to you, then you got to commit to me. Because this is the sound of two hands clapping. This is the sound of one hand clapping. Right? So that's the way that it works. So I got to know who you are. Right? And then once that relationship is established, then people refer. I have dabbled into like digital marketing and SEO optimization because I was told that I should. Honestly, it's not very successful, right? I maybe get 1 or 2 patients a month from external digital marketing, and sometimes not even that. It's really that, that whatever saturation marketing does not work.
Well, that's because he didn't hire Cyber Adjustment, but that's beyond the point. Well,
right.
We'll talk to him later and get him on the right track.
So that's the thing. Like I let my wife handle all that because, I don't have the headspace to do that. And people are like, you should do videos and you should do Instagram. And yes, I see the value in that.
For
and
sure.
100% do. I don't have the time.
But that's a good thing for you.
Right.
The fact that you don't have the time, that means there's somebody on these tables, somebody sitting in front of you and you're taking care of them.
Yes.
Yeah.
Yeah. My schedule is pretty full.
Yeah.
And so I need that. It's not to say that I don't want to do it. No, I absolutely do.
Yeah.
And my goal is to eventually hire another doctor, and we need to do that SEO and we need to do that digital marketing, because that will actually help them. And then I can actually oversee what they're doing. And so that patient gets the benefit of both of us.
That's amazing.
So that's really where the future is going for me.
I like that.
And only because I can't do this forever, to the degree.
I mean, you've had a pretty long, successful run, and you've been just a one doctor operation the entire time?
For most of it, yeah.
Wow.
Yeah. Nobody sees my patients but me.
Wow. That's dedication, man. I love that.
I had an independent contractor in here for a while, but it was like a practice within a practice. He saw his patients. I saw mine.
What advice would you give a newer chiropractor who's seeing kind of drop-offs, losing retention, maybe questioning their own confidence in their method?
That's an easy one. Specialize in something. Be different. My patients pass probably 30 chiropractors to get to me, depending on where they come from. And I've got people that come from as far north as Virginia and as far south as Georgia.
Wow.
Okay. So specialize in something. It doesn't have to be Gonstead, but if you are a specific chiropractor, you are my brother or sister, right? And I love you because you are specific and because you have the tools or the tool to help your patients better. You don't have a bag of tricks.
Yeah.
Right? You are a specialist.
Yeah.
And you can really help people.
Yeah. Yeah. Maybe we do have some future goal questions here that I can throw in here. I want to talk a little about the kind of vision, right? So I kind of want to wrap things up with maybe big picture view. So you stayed committed to Gonstead, even as many in the profession move kind of towards shorter, easier models. There's franchises out there that I wouldn't touch with a 10-foot pole, man.
I know
conveyor belt situations.
Let me say this about them too. They have their place, right? Because not everybody can afford the best.
Yeah.
Okay.
Yeah.
And
I understand that.
You know what?
Sure.
If you just need someone to put their hands on you and rack a vertebra into place,
going to help at least. Yeah.
It has a benefit, right?
Agreed. Yeah.
Even if it's placebo, a placebo is an absolutely valid medical treatment.
Yeah.
So even if they do something and it stimulates neurology in some way, hey, I have no judgment.
Yeah.
But I agree.
Yeah, dude. Actually, I wouldn't judge a book by its cover, because just because it's a franchise doesn't necessarily mean they're not doing good work. I was going to 100% Chiropractic right across the street over here. Dr. Juan Escobar. Phenomenal, because he cared about the patient. He asked the questions. He understood why you were there. Everything that you touched on I did with Dr. Juan. I still see him. He actually has ESCO chiropractic, same road, just right down the street, moved over. But the point is, so you stay true to this, we'll call it specialization, obviously.
Yes.
What does that mean for the future, not just of your chiropractic practice, yours? What does that mean for the chiropractic industry? Do you see, now that we're all looking for these shortcuts and these overnight things and the quick fix and the cracks and the TikToks and the and all this, like how do you see Gonstead or specialization growing, or is it?
I don't think it is.
Mm,
I am actually very fearful for it.
mm,
We're dinosaurs, man. We grew up before all of this,
yeah.
and I really have to beseech the younger generation to take up this torch.
Yeah.
And carry it. And it's not that you're a retro or you want to be, because it's the truth and it's what patients need. And, we are a generation away from losing specific chiropractic, because then it just becomes all about money.
Yeah.
And it becomes all about how fast you can get a patient in and fast out. And it's perpetrated by guys out there that are like, say, I'm seeing 1,000 patient visits a week, in an open room, adjusting with the patients down. And, somebody puts them down there and the doctor comes in and crack, 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 and moves on.
Yeah.
Well, and that's, they use guerrilla marketing tactics and, a lot of videos, and it's just herd mentality is the way that you do that. And I don't agree with that. I think chiropractic is so much more and so much more valuable.
100%.
And this is, doing stuff like that is why the public looks at us the way that they do. They don't respect us. They don't value us. They don't think we're real doctors. I just saw a post on Reddit, some guy ranting about how chiropractors are not real doctors. No, we're not doctors that prescribe and treat, because we see what a failure that is. And I don't have to tell you, the statistics are there. Just go look. Are we healthier because of medicine?
Quite the opposite.
Right?
Quite the opposite.
Are we a healthy country?
Yeah.
So why I understand why they do it, because they bash it because they don't understand it, but they also bash it because we've done a poor job of educating the public.
Absolutely.
And we've taken a shortcut because we've pursued money instead of principle.
Yeah. Having a carousel of pills when you're 60, 70 is not a successful thing. Like having to, I see that in around me. There's people in my life that have that. They don't want it, but they're in it now.
They're in it. My older patients, minimum are on 8 different medications.
Yeah, that's low, unfortunate.
So I'm worried about the future.
Yeah.
And we've got to do better about all of us, I think, as Gonstead doctors, opening our clinic. I do workshops with kids from Sherman College, but again, it's hard for them to just come up there and then they're in school and, you just have to encourage them to keep going and do it, because we need them. We need them to do it.
Yeah. So for anyone listening who wants to maybe schedule some time with you, learn more, maybe follow your work, what's the best way they can get in touch?
If you go to my website, it's GonsteadChiropracticCenter.com, and there's videos up there and you can see more about me and what I do. You can always call me on our clinic. It's 803-547-9977. And you can schedule a consultation. And if you say that you saw it on this podcast, we will give you our consultation special. I can't remember exactly what it is. I don't even talk money.
We'll ask his wife.
Yeah, my wife will know. But I know it's not exorbitant. It's less than $100. If you come in, you'll have a consultation, exam, digital x-rays if needed. And then I can just evaluate you and take a look. My goal is not necessarily to take you on as a patient. If you want to do that, wonderful. My goal is to give you information, because where the benefit of Gonstead, where it really shines, is the x-ray analysis. I will tell you stuff on your x-rays that you've never heard, because that's our training.
Yeah.
Right.
Yeah.
And so at least you leave here with the information to know what is going on with your spine right now. And then you have the decision of whatever you want to do and how to correct it. Whether it's with me, whether you find another practitioner, I don't know. My job is to give you the information.
Do you ever do maybe virtual consultations to answer questions or anything like that? I know you need hands-on at chiropractic, but maybe a preliminary conversation.
I don't do that because I like to meet face-to-face. However, if somebody's like sending me a set of x-rays and it's like, hey, what do you think about this? I'm happy to do that.
Okay.
And there's no charge for that. I'm going to, after this, look at some MRIs that a patient sent me of one of her family members. Yeah, I will do that for sure.
Awesome. Thank you for that. Okay. And then for the chiropractors listening who are in the thick of it, what's one mindset or principle that helps you stay the course when things get hard?
You are a crazy son of a gun to be doing chiropractic. No, I'm just kidding.
Get out, run.
Yeah. What? You were called, right, to do this.
Yeah.
I certainly was. If you had told me 25 years ago that this is what I would be doing with my life, I would have said, you are crazy. You are in chiropractic for a reason. Somebody has called you to do it. And so you owe it to God, to innate, whatever you think that has pushed you in your life to go through school and to do this, to be the best that you can be for your patients. And if you do that, you will have such a fulfilling and happy practice and happy life. And it sounds really Hallmark, but it's the truth.
Yeah.
Never stop pursuing excellence.
I love that.
Because the pursuit of excellence, the journey, it's not the destination, it's the journey.
Yeah.
That's where the fun is and the magic.
Yeah, for sure. Well, Dr. Rich, thank you again for joining me today. And again, kind of opening up your practice for us to do this recording. So I really appreciate your time.
It's a pleasure, buddy.
Yes, sir. Thank you so much. That's a wrap, folks, with Dr. Rich Benjamin from Gonstead Chiropractic in Fort Mill, South Carolina. It's been an origin story you couldn't script any better, and a commitment to healing you don't see as often as you like these days. But this has been Beyond Adjustments. I'm your host, Amin Said. And whether you're a doctor, a parent, or someone just trying to feel a little better each day, remember, you don't have to change everything. You just have to adjust what matters.